MTP. Medical termination of pregnancy, MTP, is a procedure that is performed to end a pregnancy. It is also known as induced abortion and is a safe and legal medical procedure. It can be carried out in various settings such as hospitals, clinics, and abortion clinics. There are two methods of MTP, medical and surgical. Medical MTP involves taking medications to end the pregnancy. Surgical MTP involves a surgical procedure to remove the fetus and placenta from the uterus. In this response, we will focus on the medical method of MTP. Medical MTP involves the use of two medications, Mifepristone and Misoprostol. The procedure is usually done up to 10 weeks of pregnancy. Step 1, Counseling and confirmation of pregnancy. The first step is to confirm the pregnancy and determine the duration of pregnancy. The woman may be counseled about the procedure, the possible risks and complications, and the options available to her. The woman must give informed consent before the procedure can be carried out. Step 2, Administration of Mifepristone. Mifepristone is given orally in the doctor's office or clinic. The medication blocks the hormone progesterone, which is essential for the pregnancy to continue. This leads to the separation of the fetus from the uterine wall, and the cervix becomes soft. Step 3, Administration of Misoprostol. The woman is sent home with a prescription for Misoprostol to be taken within 24 to 48 hours after taking Mifepristone. Misoprostol is taken orally or vaginally, depending on the doctor's recommendation. Misoprostol causes the uterus to contract and expel the contents. Step 4, Follow-up appointment. The woman is advised to return to the clinic for a follow-up appointment within 7 to 14 days after taking Misoprostol. During the follow-up appointment, the doctor will confirm that the procedure was successful and that there are no complications. Complications of medical MTP may include excessive bleeding, infection, incomplete abortion, and injury to the uterus or other organs. It is important to seek medical attention if you experience any unusual symptoms after the procedure. It is important to note that MTP is legal in some countries, but not in others. The laws and regulations around MTP vary widely between countries and regions. It is essential to check the legal status in your country or region before considering the procedure. What is Mifepristone? Mifepristone is a medication used in medical abortion procedures. It is also known as RU486 or the abortion pill. Mifepristone works by blocking the hormone progesterone, which is essential for the maintenance of pregnancy. By blocking progesterone, Mifepristone causes the lining of the uterus to break down, leading to the detachment of the embryo from the uterine wall. This makes it easier for the uterus to expel the embryo during a medical abortion procedure. Mifepristone is usually taken orally in the form of a pill or tablet, and is often given in combination with another medication called Misoprostol. It is important to note that Mifepristone should only be taken under the supervision of a licensed medical professional. What is Misoprostol? Misoprostol is a medication used in medical abortion procedures. It is a synthetic prostaglandin E1 analog that works by causing the uterus to contract and expel its contents, including the embryo and the placenta. Misoprostol is often used in combination with another medication called Mifepristone to induce medical abortion. After Mifepristone is administered, Misoprostol is usually given orally or vaginally, depending on the doctor's recommendation. Misoprostol can also be used to treat other medical conditions, such as stomach ulcers and cervical ripening before labor induction. It is important to note that Misoprostol should only be taken under the supervision of a licensed medical professional. It can cause side effects such as cramping, nausea, vomiting, and diarrhea. Mifepristone and Misoprostol are available under different brand names and manufactured by various companies. Here are some examples. Brand names of Mifepristone: Mifeprex, manufacturer, Danka Laboratories. Korlym, manufacturer, Corcept Therapeutics. Brand names of Misoprostol: Cytotec, manufacturer, Pfizer. Misodol, manufacturer, Ferring Pharmaceuticals. Miso1, manufacturer, Lupin Pharmaceuticals. It is important to note that the availability of these medications may vary by country. They may not be available under the same brand names or manufacturers in all regions. Additionally, the use of these medications for medical termination of pregnancy may be subject to different regulations and restrictions in different countries. It is always important to consult with a healthcare provider and follow the appropriate protocols and guidelines for using these medications safely and effectively. Is Mifepristone safe? Mifepristone is a safe and effective medication when used as directed by a licensed medical professional. It has been used for many years in countries where medical abortion is legal. It is considered to be a safe and effective method for terminating early pregnancies. Side effects. However, like any medication, Mifepristone can cause side effects. The most common side effects of Mifepristone include abdominal cramps, nausea, vomiting, diarrhea, fever, and chills. In rare cases, serious complications such as heavy bleeding or infection may occur. But these are usually rare and can be treated with medical attention. It is important to note that Mifepristone should only be taken under the supervision of a licensed medical professional. She can evaluate your medical history, confirm the pregnancy. She will determine the appropriate dosage and timing of the medication. Women who have certain medical conditions such as bleeding disorders, adrenal failure, or are taking certain medications, may not be good candidates for Mifepristone. They should discuss their medical history with their healthcare provider before taking the medication. Overall, Mifepristone is considered to be a safe and effective medication for medical abortion when used under appropriate medical supervision. Who should not take Mifepristone? In a regimen with Misoprostol, for medical termination of pregnancy. Mifepristone in combination with Misoprostol is a safe and effective method for medical termination of pregnancy when used under appropriate medical supervision. However, there are some cases in which Mifepristone should not be used or should be used with caution. Mifepristone is not recommended for women who have an ectopic pregnancy, a pregnancy outside the uterus. It is not effective in terminating such pregnancies and may delay the diagnosis of a potentially life-threatening condition. Mifepristone should also be used with caution in women who have certain medical conditions. They include bleeding disorders, adrenal failure, or are taking certain medications, as these conditions can increase the risk of complications. Women who are allergic to Mifepristone or Misoprostol should not take these medications. It is important for women to discuss their medical history with their healthcare provider. It should be done before taking Mifepristone and Misoprostol for medical termination of pregnancy. There are certain medical conditions that may make the procedure unsafe or increase the risk of complications. It is also important for women to follow the instructions of their healthcare provider closely. They should seek medical attention if they experience any unusual symptoms or side effects after taking the medications. What are the possible side effects of using Mifepristone for medical termination of pregnancy through 10 weeks gestation? Mifepristone is a safe and effective medication for medical termination of pregnancy when used under appropriate medical supervision. However, like any medication, it can cause side effects in some women. The most common side effects of Mifepristone for medical termination of pregnancy include abdominal cramping, nausea and vomiting, diarrhea, headache, dizziness, fatigue. These side effects are usually mild and resolve within a few days after taking the medication. Less common but more serious side effects of Mifepristone for medical termination of pregnancy include heavy or prolonged bleeding, incomplete abortion, the pregnancy does not completely terminate, infection, allergic reaction. It is important to note that most women who use Mifepristone for medical termination of pregnancy experience only mild side effects, and serious complications are rare. However, women should be aware of the potential risks and should seek medical attention. If they experience any unusual symptoms or side effects after taking the medication, it is also important to follow the instructions of your healthcare provider closely. You should attend follow-up appointments as scheduled. You should also have a plan in place for managing any potential side effects or complications. Is it possible for an individual to become pregnant again after taking Mifepristone for medical termination of pregnancy through 10 weeks gestation? It is possible for a woman to become pregnant again after taking mifepristone for medical termination of pregnancy through 10 weeks gestation. Mifepristone works by blocking the hormone progesterone, which is necessary for the pregnancy to continue. This causes the lining of the uterus to break down and the pregnancy to be terminated. Once the pregnancy has been terminated, the woman's menstrual cycle will usually resume within a few weeks, and she can ovulate and become pregnant again. However, it is recommended that women wait at least 2 weeks after taking mifepristone before having sex to reduce the risk of infection and allow time for the uterus to heal. It is also recommended that women use contraception after a medical termination of pregnancy to prevent another pregnancy until they are ready to conceive again. It is important for women who have had a medical termination of pregnancy to discuss their contraceptive options with their healthcare provider. They should choose a method that is safe, effective, and appropriate for their individual needs. What may interact with this medication? Mifepristone may interact with certain medications and herbal supplements, which can affect its effectiveness or increase the risk of side effects. It is important to inform your healthcare provider about all medications and supplements you are taking before using mifepristone for medical termination of pregnancy. Some medications that may interact with mifepristone include medications that affect the liver, such as ketoconazole, itraconazole, erythromycin, and rifampin. Anticoagulant medications such as warfarin, as mifepristone can increase the risk of bleeding. Corticosteroids, as they can decrease the effectiveness of mifepristone. Herbal supplements that affect blood clotting, such as garlic, ginkgo biloba, and ginger. Herbal supplements that affect the uterus, such as black cohosh and donkey. Certain antivirals for HIV or hepatitis. Certain medications for seizures like carbamazepine, phenytoin, phenobarbital. Grapefruit juice, St. John's wort. Is mifepristone approved in any other countries for medical termination of pregnancy? Yes, mifepristone is approved for medical termination of pregnancy in many countries around the world. The medication has been approved in France since 1988 and is now available in more than 60 countries, including the United States, Canada, Australia, and most of Europe. In many countries, mifepristone is available as a prescription medication.